since I'm a colorectal surgeon, so patients come to me with hemorrhoidal disease, what they call as piles, and most of the time the symptoms are bleeding while passing stools. Some people complain of pain, sometimes it is itching, or sometimes it is swelling in the perianal region. Most of the time, the treatment when we start, it is medical management. We start with high fiber diets, stool softeners, and flavonoid fractions. The question for me today is, as you asked, when do we actually advise surgery? The surgery is advised whenever there are some two questions involved. One is what type of surgery should be done and when the surgery should be done. Coming to the second question, when do we advise surgery? Surgery is advised whenever the symptoms are significant. Some very absolute indications are some people come with torrential bleeding causing anemia and significant bleeding which cannot be controlled medically. These are the patients who benefit from a hemorrhoidal surgery. The second group of patients come with repeated attacks of bleeding. They will be on medical management, but either they do not respond to the medical management or these people tend to have repeated attacks of bleeding. These are the patients usually who have the disease for a longer duration and they have grade 3, grade 4 hemorrhoids. That is the time when we advise surgical management for hemorrhoidal disease. Third group of patients are patients who have early stage hemorrhoids, but they come with very severe pain. Sometimes bleeding is not the issue. These people will have severe pain because of the acute thrombosis of the hemorrhoids. Here also, first line of management is medical management, but the pain is unbearable and going to the next motion is also a issue for them. Then surgery gives a rapid relief for them from the symptoms. Coming to surgery, the type of surgery varies. The conventional management of hemorrhoids surgically involves, because the hemorrhoids are causing problem, we remove the hemorrhoids and that's the end of the treatment. But there's a problem with this. Hemorrhoids are there in the body, they have a certain function of keeping the anal canal closed. Suppose if we remove the hemorrhoids, these patients tend to develop seepage of mucus, liquid stools after the surgery. So the concept of surgery now has changed. The present concept of surgery is to shrink the hemorrhoidal tissue, to reduce the risk of bleeding and preserve the hemorrhoidal tissue, not to remove completely. We need to shrink the hemorrhoidal tissue and control the bleeding. And for this, various surgical options include, the present one best option is laser hemorrhoidoplasty in patients who have large hemorrhoids with bigger prolapse, grade 3, grade 4 hemorrhoids or significant bleeding. The hemorrhoidal tissue is very big. Sometimes laser may not be effective in grade 4. That is the time when we advise stapler hemorrhoidectomy. Nowadays, even ligature hemorrhoidectomy is being advised, but it is early days. The conventional established ones are laser and stapler hemorrhoidectomy. Those patients who have grade 3, grade 4 hemorrhoids with significant prolapse, these are the patients where the hemorrhoid tissue has enlarged and is starting to prolapse outside from the anal canal. These are the patients who have a bigger hemorrhoids, and in these patients, laser coagulation is sometimes not as effective as in earlier stage hemorrhoids, and the chance of recurrence is more. To correct the prolapse, what we do is a stapler hemorrhoidectomy. What we do in this is we remove a ring of tissue at the upper end of the hemorrhoids. So in the hemorrhoids and the anal canal, which pulls the hemorrhoids inside. So this reduces the prolapse, shrinks the hemorrhoidal tissue, controls the bleeding. So the advantage of laser hemorrhoidoplasty is significantly much lesser pain, so earlier recovery and faster return to work. But those patients who have larger hemorrhoids, their laser, when it is unlikely to be effective, that's the time when we advise stapler hemorrhoidectomy. The slight flip side is it's slightly more painful post-operatively. They need at least around 1 week to 10 days. People tend to complain of pain, but the chance of recovery in these patients with stapler hemorrhoidectomy, suppose the hemorrhoids are big, then this is a better option. So to conclude, hemorrhoid surgery is advised in patients where the symptoms are significant. That means the bleeding is either severe or for a longer duration. Those patients who are not responding to medical management, or those patients who need a rapid relief because the pain and the symptoms are so severe, they do not have that much time to wait for the response for the medical management. These are the main group of patients where surgical management is advised.